Good afternoon, everybody. Thank you for joining us this afternoon. We have quite a large audience on the phone today with well over 300 individuals listening in to our all-member COVID-19 briefing. So as we all know, this is a very dynamic situation that is evolving, typically hour from hour right now. And so we hope to bring you some of the latest news as to what is being heard. As a reminder, please ensure that you mute your phone or computer so that we don't get background noise in the call. So my name is Andy Van Zee. I am Vice President of Regulatory and Hospital Operations here at the Indiana Hospital Association. So today, to lead off, would like to turn it over to Dr. Lindsay Weaver. Dr. Weaver serves as the Chief Medical Officer for the Indiana State Department of Health. Dr. Weaver, the floor is yours. Dr. Weaver, are you on mute?
Can you hear me now?
You can, thank you.
Great, thanks. I've always wanted to say that. Thank you all for your time this afternoon. As mentioned, I am the Chief Medical Officer for the State Department of Health, and unfortunately was not able to provide slides for you today due to this ever-changing situation. So I'm going to provide you with the most up-to-date information that we have, but please keep in mind that this continuously changes. So our recommendations today may not be what our recommendations are tomorrow. So I first just want to start with giving you a brief overview. As you know, this new or novel coronavirus is a respiratory illness that is spread by droplet, so respiratory secretions, people coughing and sneezing. It started in Wuhan, China, and has spread globally. So right now, the total global confirmed cases is over 105,000, with a total global deaths reported greater than 3,500. We've had 423 cases confirmed in the United States, and 49 of those were repatriated persons. The U.S. total deaths is 19. In Indiana, and this is probably the most up-to-date news, we have tested a total of 32 people, and that includes some that were sent to the CDC originally before we had our test, and we now have had 4 positive cases. So you'll hear us say that those are presumed positive, and the reason being is that they aren't confirmed until the CDC is able to check them. So of those 4 patients, there are 3 adults and 1 child. 2 of the adults did have contacts in association with the Biogen conference, where there have been over a dozen confirmed COVID-19 cases. The other patient also had a history of travel, and we are looking further into the possibility of being exposed on that travel. And then the child is a relative of one of the adult patients. The 2 of the adults and the child are all isolated and doing well, and 1 adult is currently hospitalized. So there are 2 cases in Hendricks County, 1 in Marion, and 1 in Noble County. The next thing I wanted to make sure that I went over with you is our current testing situation, and I would appreciate if people could help spread this information. So the ISDH is very limited in our ability to do the COVID-19 test at this time. You probably heard it reported that we had 800 or 900 tests. Those are actually 800. We had 800 reagents. So one specimen could use up to 15 reagents in order to perform the test. So as you can imagine, as testing has increased, we have gone through those reagents relatively quickly, and we are unsure when we will get some more from the CDC and heard that they are on back order. We are hopeful that we will get them soon, but right now we are testing with keeping in mind that at this point we are limited. That being said, we do know that tests can be sent to LabCorp or Quest And so if you know with your hospital that you work with one of those companies, to find out how testing goes through them. We will tell you that we've heard that there is a longer turnaround time of about 3 to 4 days prior to getting those tests back. So you're probably wondering, how are we prioritizing testing? Right now, we're going to test those who are severely ill. Test people who are severely ill and hospitalized, who have respiratory symptoms and history of fever, possible connection to a COVID-19 patient, or have unexplained source. So they've tested negative for other viral illnesses. We would prioritize potentially a healthcare worker that is symptomatic and have potential exposure, because as you would imagine, that would change how we would approach the situation. And again, as I said before, this is fluid, so things may change as we have more tests available. Just making sure I have everything here. Yes, okay. So the other thing I'd like to make sure everyone understands is how we've been testing people to this point. I am happy to say that our 4 positive cases all were tested at facilities, and of at least the 3 here in the Indianapolis area, PPE was appropriately worn, so we don't believe that there was any exposure to healthcare providers. How that worked out is that the facility was notified prior to the patient arriving, and the patient was brought in by someone in full PPE. The patient was wearing a mask, taken into a negative pressure room. The number of healthcare providers that had exposure to the patient was limited. And then the patient was again escorted out wearing a mask. So I think that's something very important for everyone to make sure that they have policies and protocols in line with that, that if you were to have a patient that called ahead, that those things were taken into account. So how can we best limit exposure to our healthcare providers? As many of you may or may not be aware, the recommendation is for healthcare providers that were in high-risk close contact. So, for example, maybe intubating a patient that turned out to have COVID-19 without wearing the proper PPE. The recommendation at this time is that those healthcare workers are isolated for 14 days and unable to provide for any other patients. I'm an emergency medicine physician by training, so I'm speaking with my colleagues frequently that if they have any suspicion that they have someone that's coming in respiratory distress, that before they perform any of those high-risk procedures, that they be sure to take all precautions, because we really want to protect our healthcare workers. Other things that I'm hearing from different hospitals and hospital systems of how they're planning on handling this situation is setting up, for example, drive-throughs where people can come through in their car, quick vital signs or, quick exams, and then testing patients, setting up outdoor areas with filters and screens the best they can to test patients. Also, in-home mobile units. So basically sending out a nurse provider that could go to the home to test patients. There's great recommendations on the CDC website about how to do this and how to follow all the proper precautions. And additionally, telehealth. So if you have any capabilities to provide telehealth to your patients, I think that this is a great time to ramp up that, as well as training of schedulers and nurse lines on how to best direct patients. So I think even as if we were to have the increased capability of testing, as this spreads in the community, everybody does not need to be tested. So we're in the screening and surveillance, and so we were testing people that had contacts and travel and things like that. But as it gets more spread into the community, our recommendation is if you're sick, then stay home, and especially to make sure that you stay away from people who are most at risk. So what we've been reading and we're hearing from the CDC, the people who are most at risk are those who are older than 60, who have multiple medical problems, especially if they have respiratory disease or other cardiopulmonary disease, and people who are immunocompromised. So I think it's important that we spread that in the community, that this isn't the time for everybody to run to the emergency department to get tested. If you have mild illness and can care for yourself at home, then it is appropriate to do so. It's also appropriate to educate patients and their families on proper self-isolating and social distancing, including, staying away, like I said, from those people that could potentially be at risk. An update on the PPEs. Thank you to all of you who are logging into EM Resources and giving us daily updates. Honestly, this is going to be the best way for us to keep track of how everyone is doing across the state. Specifically with the PPEs, as those of you who have logged on and are putting in your data every day, and if you have not, we ask that you please do so. There's a spot to say whether you are in the green, so you're doing good with your personal protective equipment like N95s and gowns. You're in the yellow, so you're running a little bit low, or you're in the red, which tells us that you are in immediate need of something like N95s or surgical gowns. So the people that are in the red, we are giving them a call and finding out, how short are they and what are their immediate needs, what exactly are they needing, and we'll see what we can do to help. So we do have a limited supply of N95s here with the Indiana State Department of Health that we will provide hospitals to care for patients. So this is not, for example, if it were gowns, this wouldn't be to perform elective surgeries. It would be if you had, patients that you were actively taking care of with COVID-19 and needed the proper equipment to be able to take care of your patients. We will also have the ability of asking other resources for more. But as you can imagine, we're looking at a potential shortage across the nation. So we're staying up to date with all the changes in that, and we're hearing that there's going to be more opportunities for obtaining, especially N95s. I would look into, talk to your supply chain leaders, whether or not your N95 masks had waivers for expired masks. Several companies came out and extended the expiration date several years. So that would be something important to look into. In talking to other states where this is more widespread, for example, we heard from the State Health Commissioner of Washington that they did move to using the WHO, so the World Health Organization, requirements for personal protective equipment. And so if you look up those, the difference basically is that they say definitely to use N95s or PAPRs, but that level of aerosol, of airborne precautions when doing aerosol producing procedures. I always like to remind everyone that doing an NP and an OP swab, so an oral pharyngeal and a nasal pharyngeal swab, is considered to be a potential aerosol producing procedure. And so at that time, a N95 or PAPR mask is recommended. And the reason I take the time to point that out is because I've had a lot of people ask me about can we do testing out in our outpatient facilities? And that is why the recommendation right now is no. Because those are considered aerosol producing, meaning, essentially if you put the swab in someone's throat or nose, you have the potential of making them cough. That we want to make sure that we protect our healthcare providers, and the recommendation from the CDC and also the World Health Organization is that that person be wearing an N95 mask or a PAPR. At that time. So that is why we are refraining from saying that it's okay to be testing in outpatient facilities, because we know that our community physicians, urgent care facilities, et cetera, most likely do not have access to that equipment, and also that they wouldn't have access to a negative pressure room in order to perform that test. The other thing to keep in mind is that, again, with the worried well, so people who are symptomatic but mildly symptomatic, that they are recommending isolation for people at home who are COVID-19 positive. But as I mentioned before, with a shortage of tests, that we're going to be telling a lot of people you may have it, and so here are the recommendations. So we need to make sure that our providers are educated and know how to best inform their patients. And that also would go for hospital personnel, making sure that whatever telework opportunities that you have are put into place, and that people who are potential to come in contact with at-risk patients are screening themselves for symptoms. Whether or not at this point they know for sure they've been in contact with the COVID-19 patient, if we are thinking it's going to start spreading through our community, we need to all be monitoring our symptoms. And as said 100 times at this point, stay home if you're sick, cover your cough and sneezes, use alcohol, sanitizer, wash your hands, and et cetera. We have heard from other places where this has, again, become more widespread, that they reduce the isolation recommendations from 14 days down to 7 days or 72 hours after stopping symptoms, but we have not gotten that recommendation from the CDC. The only reason I bring that up is this is one of those things that, as I mentioned, is in flux, and so don't be surprised if the recommendations change over time. The other important thing, which I already kind of mentioned, is healthcare worker exposure. The CDC has a great chart explaining what is considered to be a high-risk exposure versus a low-risk or a no-risk exposure. So I'm sure all the infection prevention people are on top of this and are aware, but it's something to keep in mind for potential exposures. And again, we've heard varying reports that when you are in the thick of things, that there have been some, they have changed the recommendations from 14 days down to 9 and et cetera. At this point, the CDC is still recommending 14 days for someone who potentially had a high risk exposure but never become symptomatic. Of course, if a healthcare worker did become symptomatic, then that does change the situation. I think that is a lot of information in a really short amount of time. I am open to questions. Andy, if you want to open it up for people to ask me any questions, something that I need to cover or could cover better.
Yeah, so if anyone has a question that's logged in, you can type that in the chat box. We do have one question asking around if there is extra concern for pregnant women.
Thank you. So we have not seen that in the literature, and as you know, it is very limited what we know so far. That being said, we always tell pregnant women that they're at higher risk just based on their physiology, and so that it would be recommended that they would stay away from anybody who is positive. And I think for all of us that it should also be a consideration for our healthcare workers that if when can be avoided, that someone who is pregnant and potentially has that higher risk of being immunocompromised and of getting sick, that when it can be avoided, that they may not want to take care of one of these patients.
So a question asking, is there any recommendations as far as community events or seminars that are being hosted at the hospital? What is the state's recommendation for those events?
I think so basically, like, should we be having large gatherings? I think that we have all learned a lesson of what occurred with the Biogen conference, that we've had so many people test positive from there. So I think limiting any kind of big events where you're bringing a bunch of people together in a room is wise at this time, and the best that you can to try and figure out other ways of getting out information, whether it be things like this, a webinar, webcast, video conferencing. I think it's definitely reasonable at that time to consider whether it's necessary to bring large groups of people together.
What is the pre-laboratory work that is required by ISDH before recommending testing?
So what we're asking, and this is definitely in flux, I mean, literally it is on my desk right now, and we're working on it, so to help with our state epidemiologists to help them decide who to test, and also for all of you. But right now, like I said, we're going to test people with severe respiratory illness, so requiring, high flow oxygen, BiPAP, intubation with respiratory illness and fever. with a negative flu test and preferably a negative RVP, so respiratory viral panel, but we know that a lot of people have, that's quite a delay, up to several days before they would get that back, where we know that other facilities are able to get a decent turnaround time on it. So if you're one of those hospitals that you're like, hey, we can send out the RVP, but it's going to take days, but we have a super sick patient in our ICU that we can't find another source on, and we're worried has COVID-19, that would be somebody that we would consider. Or we would consider not having to wait for the RVP, but we would at least ask for the flu. Based on the initial studies we're looking at, we're not seeing very much co-infection, but it's something we're going to keep an eye on.
So for those that are recovering at home, are there any recommendations as far as at what point they would be ready to return to work or return to society?
So right now, the CDC recommendations are that they are asymptomatic and also that they've had 2 negative nasopharyngeal and an oropharyngeal swabs, so 2 sets of tests 24 hours apart that are negative. Given our limited testing right now, I can tell you that right now that wouldn't be a possibility to do all that kind of testing. So we're working with the CDC to just see what would your guidelines or your recommendations be outside of doing those negative tests. I would be guessing to see if any further than that what they may say, but right now we're telling people who are symptomatic that we're not able to test, but we're worried could potentially have it to plan on being home for 14 days after their onset of symptoms and to not return to society. And so it's either 14 days or asymptomatic, whichever one. So I guess at least 14 days, and then if they're continuing symptomatic, then to go further.
Yeah. Yeah.
So as far as, is there any recommendations with respect to school closings that the state is looking at?
Yeah, so again, this is something to be much appreciated to spread in your community. So the school closings that have occurred today is out of an abundance of caution. We feel that the children at school are low risk. The CDC has asked us to review their guidelines that they put out from the MMWR in 2017 on community mitigation, and you can find that on the CDC website. But it talks a lot about that by closing schools, you decrease community spread. So closing the schools is not so much to protect the children, because we do see that they have mild illness, but it is to decrease the spread in the community so we can protect those that are the most at risk, which again are the elderly and people with comorbid conditions and that are immunocompromised. This is a case-by-case basis and is going to be very, very fluid. As you know, schools have closed in the past for flu, so that may be some recommendations that come up would be to pay attention to levels of patients being absent. We're also working with other states and again the CDC to help kind of flesh out those guidelines a little bit more. But right now this is a new situation, and so I think everyone's kind of doing the best they can and doing things out of abundance of caution. But we definitely don't want the people in the community to be alarmed, even though I can understand why they might be. But just let them know that we do feel the individual risk for children in these schools that have closed is very low.
Is there any special recommendations for handling patients that have expired?
There are, and that I don't know that off the top of my head, but I can tell you it is on the CDC website, and if you look up there for postmortem care, it's written on there. Again, and I don't know if I mentioned this, but even if you do send out an outside test, so if you send it to one of those labs that's testing, it is still reportable. So if you get back a positive, you have to report it to the Indiana State Department of Health, and it is recommended that when filling out death certificates that if COVID-19 contributed to their death, that would be listed as one of the causes of death so that we can keep track of this. But as far as care of a patient post-mortem, that information is on the website, as is all the information about how to clean rooms and recommendations about doing the home care and the other things that I have mentioned.
Is there any recommendations with respect to notifying the press of positive cases?
So we do, for these positive cases, we are working with the local health departments and the hospitals as well. There's a lot of people involved, but the Indiana State Department of Health does have a communications group that could help. As I'm sure you're not surprised, in this day and age, sometimes things get out into the press before everybody is, I guess, on the same page. But we'd be more than willing to help work with you in developing, a press release or any kind of communication plan.
There has been mention of a different strain in an infected patient. Is there more than one strain in the population?
So I've heard that report as well, and I've not heard it on the CDC conference calls, at least the ones that I've been on at this point. So I don't feel like I could appropriately comment any further on that. But like I said, it's a fluid situation. So we learn so much more really every single day.
What is the incubation period for COVID-19?
Incubation period is being reported as 2 to 14 days with on average, about a 5-day onset of symptoms, which is consistent with what we've seen with our few positive cases. We also know that patients who develop severe illness typically develop it about a week or 8 days after their onset of symptoms. So if we are telling our providers, if you see someone in the emergency department that you're discharging, that not only are you talking to them about, what does self-isolation look like at home, but also what symptoms to watch out for. So worsening shortness of breath, difficulty breathing, and then ask them that they call ahead and, where do they need to go, that wouldn't, if they were having difficulty breathing and there was a concern they had COVID-19, that would not be a time to go to a primary care doctor. At that time, they would, it's reasonable to suggest to them that they be seen in an emergency department if they have worsening symptoms about 8 days in.
As far as recommendations for monitoring, does the state have any recommendations for monitoring healthcare staff?
So the recommendations, again, are on the CDC website. They're based on exposure. I think before they were even saying to consider, monitoring before shift, and they're not doing that now anymore. I think it is, so there's 2 different things. So there's monitoring for exposure, and then there is just monitoring for all people who care for patients. And so I think that for the monitoring for all healthcare providers is that if you develop fever and respiratory symptoms, that it is absolutely at that point, a stay-at-home type situation. And again, to go into the details of the high risk, medium risk, and low risk, I recommend that you refer to the CDC website and look at their graph. It is quite helpful.
Are there any recommendations for testing those that have had previously been diagnosed with flu and having a co-strain of coronavirus at the same time?
So again, we haven't, in the limited data that we haven't seen a high risk of or high component of co-infection. And so right now the recommendation is that if someone tests positive for flu, that we would not recommend further testing at that time. And we are seeing a small resurgence in flu in Indiana, so I would make sure that everyone keeps that high on their differential for a possible cause of illness.
Is the state planning any outreach and marketing to the general public with respect to best uses of the ED and appropriate self-triage?
Absolutely. So we are working on those guidelines, but I always tell people it is best coming from their own community. So we are working on that, and feel free to then turn around and make it your own for whatever community that you live in. I think that social media is a powerful place to spread that message that, if you're sick but you're doing okay, it's totally appropriate to stay at home. And again, train up your primary care doctors and your pediatricians to help with that. This isn't the time where, every little sniffle comes in to be seen. Are you okay to be at home? Do you need to be evaluated? And if you do, then fine. But if you, have a severe level of illness, then that would be the time to go to the emergency department. Not only just to not overwhelm the emergency departments, but also to protect our patients, because that's where we're going to be taking care of the sickest of the sick. So we don't want those people to get to get exposed, and two, also we want to limit the number of exposures that we're getting to our healthcare providers.
Someone asked if you could repeat the statistics as far as the number of confirmed cases, deaths, and states.
Yep. So we have 423 U.S. confirmed case counts, and then 49 repatriated persons that were positive. Total deaths are 19, and ISCH has tested 32 with 4 presumptive positives. And we're continuing to monitor several travelers as well.
Okay. Well, Dr. Weaver, I want to thank you for taking the time today. We do have several other questions, but they are a long list, and we will download those questions and get those answered so we can get that back out to everyone who has registered for the call today.
Okay.
So I want to thank you, Dr. Weaver.
Thank you so much. I appreciate the opportunity to talk to you all.
So switching from kind of that view of the state level, wanted to give kind of a overview from a provider perspective. And as many of you are aware, mid to late last week, with the first positive case that occurred here in Marion County, and the Community Health Network had the opportunity to care for that individual. We invited several providers from Community Health Network to provide kind of a perspective of kind of the lessons learned, what happened, and recommendations from their perspective. And so would like to turn the floor over to Dr. Ioletti from Community Health Network. Dr. Ioletti, your phone may be on mute. Okay, how about Dr. Ledyard? Anyone from Community Health Network? Everyone could mute their lines that isn't speaking. We unmuted everyone.
So we now have our doctors on board. Now it's time to actually start standardizing.
It's just like this one.
All right, we'll go on to, so other resources. There was a lot of talk about EM resources. So the state has a software package as part of disaster preparedness for tracking and communicating in areas such as this. And so as part of that website, all hospitals have been put in to have a point of contact. And so as you can see in the screenshot, they are tracking the bed occupancy rate as well as supplies for PPE supplies. And so each hospital should have a lead point of contact. There are still a handful of hospitals that have not logged into the system, as well as the recommendation is this should be logged into daily to update the statistical information. And so many facilities are, I would say a strong majority of facilities are logging in on a daily basis, and would recommend to continue to do so. If you have questions as to who the point of contact is or whether your organization is signed up with EM resources in the state, you can send myself, Andy Van Zee, an email and can get that information to you. Also want to talk about a couple opportunities for getting additional information from the State Department of Health. As Dr. Weaver mentioned, they have set up a dedicated web page. Almost every day there is new information that is being posted there. Out on that website, and you can see on the screen the actual website, you can log in, you can put your email address and submit to be notified when new information is posted there. The state also has what's known as the Indiana Health Alert Network, or IHON alerts. This is a form that is utilized for notifying of high-risk cases, and so would encourage you also to sign up on that website. So we are hearing, around the state concerns around PPE shortages. Both from the masks is one piece that's talked about, as well as the gowns. With some of the recalls that occurred in China, roughly 9 million gowns were recalled. It's creating some challenges. There's just some ideas generally as far as how you can handle such shortages, minimizing the number of healthcare providers who use it, minimizing the number of times you have interactions with the patient, using alternatives to the N95 respirators. And Dr. Weaver mentioned some of the changes that the FDA and CDC have come out with respect to respirators, which would allow extended use or limited reuse of those respirators, and then prioritizing who it has use of the N95 respirators. So just going back, I believe Dr. Ialetti is now on the line. And Dr. Ialetti, you there?
Guys,
We can hear you.
can you hear me?
We can.
Yes, I actually hung up after Dr. Weaver spoke.
1419. We're sorry for.
Okay, go ahead.
Is there a specific question? Your question is about our response to the Community Health Network?
Yeah, Dr. Ialetti, could you kind of just walk us through a little bit of the scenario and maybe some of the key points you took away?
Oh, so I'm sorry for clarification about the initial patient, or just what we're doing currently?
About the initial patient, and then also maybe how that has driven to the steps you're taking today.
Sure. So the individual, he had actually came back from the Biogen conference, went home to see his family, developed symptoms, and then he went into self-quarantine. He did call one of our primary care family physicians that evening on Thursday night, stating his concern, his issues. The family physician recommended he not go to the emergency room, and then our family doc reached out to the State Department, and over a series of phone calls, over about an hour and a half or so, determined that he does need to get some kind of testing. So at that point, it was around 10 or 11 p.m. The State Department of Health did approve a test. As we heard from Dr. Weaver, the testing is very limited to select patients. So once they approved the testing, it was recommended to go to the Community North emergency room. So at that point, the patient was instructed to go to the ER and stay in their car. And prior to that, we did call the ER physicians and let them know that he will be present there. So once he arrived, he called by his cell phone to let them know he was there. And then our staff, one of our members, in the PPE came out, donned PPE on him, and then took him through a side entrance to a negative airflow room to get tested. And then he was sent back to his car, and then he went back into self-quarantine. I think one of the takeaways from that is that the providers also need to understand, as Dr. Weaver talked about, is that we need to continue to educate people on who needs to get tested and not tested. And there'll be people that may have symptoms, but if they did not have a high-risk travel, they should not try to get tested. And for those people that we do think need to get tested, we ask them to stay home, and we contact the Department of Health. A knee-jerk reaction for a lot of physicians would be to simply tell the patient to go to a med check or emergency room, and it would be imperative in this particular situation to not do that, but try to triage over the phone. And to that end, I might wrap up is that on Saturday, so because of this, by Saturday morning, we did set up a phone number, and we also put signs in front of all of our physician offices so that if you have any symptoms of respiratory illness, to not enter the building and call this number, as well on our website. So that the idea is to try to isolate people before they enter any facilities, and in our case, we direct them to a local number for them to have screening questions done by APP and RNs. And then through that triaging process, we could help determine if they should go anywhere depending on their symptoms. I think most important lesson is trying to catch patients before they walk into any facility, if at all possible.
So, Dr. Uletti, what are kind of then the future things you're considering now that you've had this case and preparing for future cases?
Yeah, so a few things. Like I said, we already established this number for all sites. In addition, our Televox, that actually tells patients, reminder of their appointments. We are modifying that automated response to say that if you have issues, if you have symptoms, please first call this number. We have, as Dr. Weaver talked about, in terms of telehealth capabilities, we do have some capabilities that we're trying to ramp up, and that for patients that, and telehealth doesn't necessarily have to mean video visits. Some of these kind of chronic conditions can be taken care of by a phone visit as opposed to a in-person visit. So especially those individuals, I think we need to keep in mind that the mortality rate is highest in individuals greater than age 60. So that in chronic, I'm a cardiologist, in patients with chronic diseases related to cardiac pulmonary issues, it's not unreasonable to call these patients have phone visits, even if you don't have video visits available. I mean, charging the insurance companies is a separate issue, but from a protecting of the individual, we're trying to implement those in as many cases as we can. And then finally, in regard to what Dr. Weaver talked about, more testing that might be available, we're in the process of setting up what we call a drive-through testing. Mackle, the lab we use, is we're anticipating they'll be able to ramp up testing within the week. So we're looking at a few sites where we'll have a large tent placed. If a patient calls our call center with symptoms or sees a provider, once they have an order, we'll instruct them to go through this quote-unquote drive-through testing. As Dr. Weaver said, is for the testing, they want people to first get the influenza A tested before the COVID-19, so we would actually get 2 specimens, and then the influenza, if that becomes negative, then we would run the COVID-19. So we're looking at setting up these testing centers to decompress emergency rooms and med checks. But the key to that also is that not every patient needs to be tested. So we have a significant education process for all our physicians and providers on who needs to get tested and not get tested, because there's a lot of concern about that, but we just are going to have limited testing availabilities.
Thank you, Dr. Uletti, for providing that insight. I mean, I think that's helpful, as other organizations start to think through their processes for how to, to handle, the foot traffic as well as, potential positive cases. So I want to turn it over to Chris Kirschner, who's the Director of Corporate Communications at Community Health Network, and kind of talk about kind of the press aspect and how to handle, when an incident like this occurs, the things to think about, and working with the state and going through that process. So, Chris?
Hi, I'm just going to say, too, I'm joined by Al Larson, who's the VP of our Marketing and Communications Department here at Community. So I'm not sure really where to start, except that we really, in this case, and we had the first case, really relied on and worked with the State Department of Health, who kind of ran that part of the process. I mean, once it was confirmed or presumed confirmed, then they decided that we needed to have a press conference, and we were able to make our folks, Dr. Uletti and Dr. Ledyard, available as part of that press conference to kind of stress, as you guys all heard, that they've been working on this. This was something we were preparing for some time, and it did just come out of the blue. And so we had an opportunity to prepare for it and be ready for it. And as part of that, just kind of started thinking through a list of questions that the media might ask in the event that we had a situation that we did. So we were able to get ahead of that a little bit, to get that in front of our leadership, and to think through it a little bit to anticipate some of those questions. Al, do you want to add something?
No, I don't. I think I think you covered it. And I think then it was just a case for us of normal media relations protocols, really understanding what the rest of the day would look like. But I think just working very closely with the state was critical and made sure that we complemented each other's efforts rather than overlapping or undercutting each other. So.
Yeah, we also made sure that our caregivers, our employees, were aware that there was going to be press around it. We were able, about an hour before the press conference took place with the state, to put out some messaging to our caregivers so that they weren't taken off guard. Those that may not have realized what was happening, we were able to share with them, hey, this is what's happened, this is what you need to know. You're probably going to see some stories in the media. So that way, they feel like they're in the loop before they hear about it from another outside source. And so that was really important. And that's something that continues, that we constantly are updating our own caregivers on what questions they might have and how it might impact them and how we're keeping them safe and how to protect themselves, as well as having that ready for our friends in the media.
All right, thank you. So I know there's a lot of questions out there, and just as we've seen, come through the chat, and, we got most of those questions answered, but, as the days go on, we expect more and more questions. And so would encourage, organizations that have these questions to send them to my attention at avanz@ihaconnect.org, and we'll have here on the last screen, you'll be able to see my contact information. A few items just to kind of, in closing, really the things you can do as far as, kind of the takeaways. One is stay informed. Signing up for the updates from the State Department of Health, both on their dedicated webpage as well as their IHEN alerts. Visit the CDC website. Much of what Dr. Weaver referenced, information is out on the CDC's website. And every day there are situational reports and new and updated guidance on testing algorithms. So I would encourage you to periodically take a look at that website. Help to inform. So educating the public using the ISDH and CDC information. Each facility should have the ability to update their status in the EMR resources and should do so on a daily basis so that from a state's perspective, we're able to, identify trends, know where beds are available, understand maybe some of the challenges around PPE supplies to see in certain regions where that may be having a greater impact than others. And then keeping IHA informed of those issues and needs so that we can help assist you in working with state agencies or working with other organizations, hospitals, and provider groups so that we can get you the answers and understand what those needs are. And then finally, staying healthy. Practicing good hand hygiene, re-educating yourself and staff on proper uses of PPE, and then use social distancing to limit potential exposure so that we can try to mitigate the spread of this virus as well as others. And so with that, we're going to close today, but we do want to let you know that we plan to have another all-member call from 3 to 4 this Friday. We will be sending out that notice here to everyone who has registered for this call, as well as through our other social media and marketing channels. So with that, I want to thank everyone who attended the call. Please reach out to myself or a member of the IHA team if you have further questions or comments about today's presentations. Thank you.